So I want to go ahead and get started. Good morning. Welcome to the week before Christmas. I'm Christy Cameron, the director at the Cole County Health Department. Again, this week, we are still seeing numbers that are on the downward trend, and we're still very cautiously optimistic about those numbers. We were happy to not see a huge spike from the Thanksgiving holidays. And we want to emphasize to everyone that it's not time to let our guard down, and we need to keep doing those preventative measures that we have been doing that have got us thus far. We want to keep, limiting our gatherings, limiting our crowd size, washing our hands, social distancing. We know that's very important. Social distancing is not being within 6 feet of someone for more than 15 minutes. We need to wear your mask when you can't social distance, keep washing hands, using that hand sanitizer, cleaning those frequently used surfaces, all the things that have got us this far. We want to keep doing them because we are cautiously optimistic that our numbers will continue to downtrend. I know that as we are moving through this pandemic, the next step has been the vaccine, and we've all been hearing a lot about the vaccine. And we're happy that it is now here in mid-Missouri, and we're in phase 1. So I want to talk a little bit about the phases and perhaps the timeline and try to give you some information. And then Dr. Adams is going to talk about if you have questions about your status and what you should do. So I'm going to share my screen real quick. I think that's going to be a very easy way to show you a new website that DHSS in the state of Missouri. So it's covidvaccine.mo.gov, or as the governor spoke about it yesterday, Mo Stops COVID. So on this website is where the state of Missouri will put out information about which phase we're in. We'll move through the phases as a state. And on this site, people can get the facts about the vaccine if you're a resident, if you're going to be a vaccinator. And this will be a very important website to bookmark and be able to watch the state status here. What I want to talk about today is towards the bottom of the page. It's this vaccine availability. So this week we are in phase 1A. The healthcare workers are starting to get those vaccines. They're starting to get them in. The supply is very limited. But as they come in, healthcare workers are number one, and they're getting those vaccines now. Also, the long-term care facility residents and staff nationwide, Walgreens and CVS have the contract to be able to go in and give those vaccines to long-term care facility residents and staff. And we are also reaching out to all those facilities to make sure that if they don't have that contract or something set up with that contractor, that we can help them to facilitate getting those vaccines for the residents and their staff. Right now at the health department, we don't have the vaccine, but we will help them, get with the partners that they need to be able to get that vaccine. There's 2 vaccines right now, and then there might be a third. Right now, it's the Pfizer vaccine, the Moderna vaccine, and then we hear there will be coming one from AstraZeneca. So during phase 1B, which will likely be at the late January, early February, again, depending on the need and the supply and the demand. That is when the health department and other healthcare partners will get involved with getting the vaccine, and we will start, vaccinating the high-risk individuals and first responders and essential workers. So more information, will be shared when we know it. It's just very early in the stages. But we want to share that information with you. We also have put a COVID vaccine section on our website, colehealth.org. But if you want to keep track of what is going on statewide, this statewide covidvaccine.mo.gov is going to be the place to look. So I'll stop sharing as long as everybody's had a chance to look at the website and bookmark it or write it down. That way it's just going to be full of great information. And then I will go ahead and transition to Dr. Adams and let her talk about maybe, if people have specific questions or what it means for you. Dr. Adams.
Sure, Christy, thanks. So we are so excited and optimistic because this week we began vaccinating our patient-facing healthcare workers. We started on Tuesday, as many of you saw, and have continued every day. So right now, we're feeling very confident that we're reaching all the frontline healthcare workers in our hospitals who want to be vaccinated. And the next thing that we would like to do as a community is start reaching out to the healthcare workers who are patient facing, but don't work at a hospital. And if any of them are interested in being vaccinated, we would like to, in the next few weeks, start to reach out to them and start to offer them the opportunity to be vaccinated, because they do fall into that phase 1A, that they're a patient-facing healthcare worker. Now, as we're moving into the phase 1B, as Christy showed you on the slides, and reaching out to educate the public about their need for being vaccinated, and if they want to be vaccinated, of course. We will first be looking at folks who are high risk because of comorbid illnesses. If they were to contract COVID-19, they would be at higher risk for having an adverse outcome or having a very severe illness. That group of people is going to be offered the vaccine first before those who are considered to be otherwise generally healthy. And also people who are in an age group above the age of 65, because they've also been shown to have worse outcomes when they do contract the virus. Also, of course, we want to reach out to our first responders and make sure that we keep them as safe as we can by offering them the vaccine if they're interested. And then other essential workers as defined by the state of Missouri. And as we're moving into that phase 1B, the state will give us direction on when it's appropriate to move into phase 1B. So I know they want to hear from us as we're moving through phase 1A, and we feel that we've reached everyone who wanted the vaccine in the phase 1A group, and then they'll let us know that it's appropriate to move into phase 1B. So right now, all that is in the planning stages, and how we're going to roll that out is still in the planning stages. We're talking about it every day in a coalition between all the hospitals and healthcare facilities in town, how we're going to make this happen. I don't have a final plan for you, but it's definitely being talked about on a daily basis.
Thanks, Dr. Adams. I agree. It's going to be a big initiative, but with everybody involved, we will tackle this issue too, and we'll make sure that everyone gets the vaccine that wants it and needs it. So Dr. Haight from Capital Region.
Yes, thank you, Dr. Adams and Christy. The three of us, as well as Dr. Sullivan and JCMG, as well as other county health departments across mid-Missouri, have been meeting for the last 6 to 8 weeks, discussing vaccines and implementing plans on initially healthcare workers. Our next phase is trying to make sure that we're reaching out to small groups, and both St. Mary's and Capital Region have started to do that, of healthcare workers who are in small groups and who have not had access to the vaccine. We will continue to be working through that over the next few weeks to make sure everyone who wants to have a vaccine, who's a healthcare worker and front-facing, is able to get one. So we will continue to work on that. One of the questions that has arisen is, when do I get to take off my mask, and when do I get to stop doing some of the things we're doing? Well, right now, we're early on with the vaccination. We still see COVID going on within our community. And I can tell you, Dr. Adams and I and Dr. Sullivan are all very happy that our numbers have gone down in our community. And we thank everyone in our public for having smaller get-togethers, for staying home when they're sick, for washing their hands, doing all those wonderful things. So we thank you all, and we hope that you will continue to do that over this Christmas season, Hanukkah, as our new year approaches, to again have our smaller get-togethers, continue to do what we're doing. We want people to continue to wear the mask when they're out and about, continue to wash your hands. As a guess, we're guessing that as the population gets the vaccination and as we get smaller and smaller numbers, we're talking about probably summertime that we'll be really talking about what can we do at this point. Do we have low enough numbers within our community to say that we can take a different approach to what we're doing now. But right now it is too soon to make changes. We, again, are just getting the initial doses of vaccine to our healthcare workers. So we need to continue to be ever vigilant, yet cautiously optimistic that we do see light at the end of this COVID tunnel. Thanks.
Perfect. Thank you, Dr. Dr. Adams and Dr. Hay, did you want to comment on the status of the hospitals right now? I know that we've had that question before, and we didn't touch on it today. It's up to you.
Dr. Adams,
We're doing really well. The numbers at the hospital are about what we would expect for this time of year, and the number of people who have an active COVID infection who are still under quarantine is also lower than it's been over the last month. So things are looking good. And again, that's all attributed to the behaviors in the community. You are the ones who have kept everyone safe. Your behavior is keeping us safe. So thank you.
Right, and Capital Region is a similar thing. We're seeing the usual number of patients we would have at this time, and our COVID numbers certainly are not where they were a month ago.